All right. Thank you for joining us for our noon press conference from the city of Tulsa. Today is April 29th, 2020. We'll start with Dr. Dart with the Tulsa Health Department.
Thank you and good afternoon. Today, we report an additional 16 people have tested positive for COVID-19 in Tulsa County for a cumulative total of 522 people. One additional individual has died, unfortunately, bringing our total to 33 residents who have passed away from COVID-19. We are constantly looking at the data in order to make data-informed recommendations for Tulsa County. We have an obligation to our residents to provide the most accurate, up-to-date, and local information. We calculate trends using a 7-day rolling average. In Tulsa County at this time, the numbers are trending flat and have not yet started to decline. We recognize Tulsans want to return to normal and want our economy to ramp back up. While we take steps forward towards those goals, our number one goal remains to keep our communities safe. In order to accomplish that, there are three main areas of emphasis that we really want to talk about today: social distancing, testing, and contact tracing. Social distancing, it's likely we will see a spike in new cases in the next few weeks as communities begin to reopen and people are moving about more so than they have been. It's very important for people to continue following social distancing recommendations. Social distancing remains our best defense against COVID-19 at this time. Stay at least 6 feet from others who do not reside in your home. We do know that by reducing the number of people a COVID-19 positive individual comes in contact with, we can reduce the potential for the virus to spread. For those who are older, who have underlying health conditions, our recommendation continues to be stay at home as much as possible until spread of the virus is significantly reduced in Tulsa County. For those individuals experiencing symptoms but do not need hospitalization, we ask you to stay home until it's been at least 7 days since your symptoms began. You are fever-free for 72 hours without use of fever-reducing meds, and all other symptoms have resolved. You will need to isolate yourself in a room away from family members if possible, and contact your healthcare provider for recommendations regarding treatment of symptoms or if symptoms worsen. Testing, of course, is really critical for our continued response. In Tulsa County, anyone who has COVID-19 symptoms or who has been in contact with someone with COVID-19 can be tested at one of our specimen collection sites. THC continues testing by appointment only. Please call 918-582-9355 to schedule an appointment. This morning, we offered a targeted specimen collection location in North Tulsa. This has been done in partnership with Tulsa Health Department, the Oklahoma State Department of Health, and Blue Cross Blue Shield Caring Van. For other testing resources, individuals may also call their healthcare provider or visit drive-through sites by appointment at OU Tulsa, OSU Center for Health Sciences, or Walmart at 81st and Lewis. 211 is another health resource and can answer COVID-19 questions and can offer assistance to those who are uninsured or underinsured. Contact tracing, I'm sure everyone has heard a lot about contact tracing. Our epidemiologists routinely conduct contact tracing on reported diseases in Tulsa County, including COVID-19. This standard public health practice allows us to work quickly to mitigate the spread of illness by assessing the risk for individuals and facilities and providing recommendations based upon that risk. We have been conducting epidemiological investigations for all COVID-19 cases since the very first case was confirmed on March 6th. We have expanded the team to now include 25 public health professionals who assist with case notification, contact tracing, and risk assessment. This is an important part of public health response. It can take anywhere from several hours to several days to work with an individual to retrace his or her steps from 48 hours prior to onset of symptoms. And it's important to remember that this process can involve multiple phone calls per person. It's lengthy, but it's a really critical process. We know that we can't do this on one call, so it takes multiple contacts with individual cases. The time can vary depending on the confirmed case itself. It can depend on how many close contacts or exposures the individual has, as well as the type of contact facility that could be involved with that potential exposure. Our epidemiologists and public health staff make contact with each individual and facility involved and work with public information to assist with communications to potential facilities and public exposures. For example, facilities where prolonged close contact may have occurred, such as a work setting, would be notified by the health department if a risk was determined to be found in that facility. As communities begin to reopen, we will continue to assess those needs and pull in individuals as needed to ensure that we are meeting the needs of the community and protecting the residents we serve. Our epidemiology team are unsung heroes, as they are not often seen, but they're always working behind the scenes to protect the public here in Tulsa County. I want to make sure we thank them for the countless hours they spent communicating their findings to slow the spread of this disease. At this time, frankly, we don't know what new normal will be. We know that things are different now and will be different for some time. As we enter a phased approach of reopening the community, Tulsa Health Department is emphatically dedicated to helping our residents do so safely. We know that employers and other organizations in our community care about the safety of the employees, volunteers, customers, and congregations as well. In order to protect safety while in this phased reopening, we have posted guidelines on our website for industry-specific businesses. These documents contain general guidance and strategies to support the business and nonprofit community. These guidelines include food establishments. Routine inspections have been continued by our food protection services throughout this public emergency. Our sanitarians have been providing guidance over the phone or in person for modified procedures for curbside or for delivery service. Any establishment that's in good standing with us will not be required to pass an extra inspection to allow them to reopen, as frankly they stayed open during this response. We will continue to offer guidance and support to restaurant owners for their employees on what these phases will look like while protecting the consumers and their staff's health. Current guidance includes recommendations to screen customers, employees, and vendors for symptoms of COVID-19. Additionally, enhanced cleaning protocol must be followed. A 6-foot distance must be maintained between parties. Employees should always wear masks. Food Protection Services is available to provide consultation to any food establishment in Tulsa County. Call the Tulsa Health Department with questions, and consumers can report violations using our website. I want to remind everyone that mosquito and tick season is upon us. Our vector control program will begin as planned and will be in place all season as needed. Our vector control program is available to complete the task while maintaining required distancing and THC policies. We deploy traps this week, and the goal is to test and actually report testing beginning this Friday. We typically start the program the first week of May. Trapping is starting a tiny bit earlier to capture potential for early West Nile positive mosquitoes. The American Mosquito Control Association has stated at this time mosquitoes cannot transmit COVID-19. We've gotten those questions. That's important for people to know. You can help prevent the spread of mosquitoes by dumping standing water on your property and wearing EPA-approved repellents when outdoors at dawn and dusk. Residents can report mosquito complaints online on our website, or they can call 918-595-4200 to report any mosquito-related issues. We know this has been a difficult and challenging time. Thank you all for your sacrifices you made during the month of March and April to help slow the spread and to lessen the surge on our hospital systems. It's been working. And let's be mindful of the fact that staying apart has been working. Let's continue that diligence into May. We will slowly and safely reach our goal of restored economic health because we took the right steps now to restore and secure our community's health. And I want to thank you all for following recommendations during this difficult time. We know it has not been easy, but we do know that these recommendations are working. At this time, I'd like to turn this over to Mayor Bynum.
Thank you, Dr. Dart. Mayor G.T. Bynum, City of Tulsa.
Thank you very much. And to hear Dr. Dart remind us that we're going into mosquito season after what we just went through last night in the middle of a pandemic, you kind of wonder when the locusts are going to show up, right? I'd like to explain from a larger standpoint what we're going to enter into on May 1st, because I think it's important to take a little bit of a step back and look at this overall event in phases. So you can think about really two extremes that we've been through as a community over the last couple of months. You can think about what your life was like in February, where social distancing was probably not a term you'd ever even heard, and we weren't being encouraged to wear masks or stay at home. We were able to go about our lives just as most of us always had and always knew. And the reality, based on all the public health guidance that I've seen, is that if we kept doing that, the results would have been disastrous for Tulsa and for cities all around the United States. So instead, we took an unprecedented step as a community and went to a different extreme in which we implemented very strong social distancing practices early in the course of the virus hitting our community. And the willingness of Tulsans to act early and to do what we had to do to protect our neighbors and our healthcare system is the reason that you see our overall death rates per 100,000 citizens so much lower than in so many of the cities around our country that you hear about on the news. There is no question in my mind that the actions of Tulsans to practice social distancing and to isolate ourselves from one another and to minimize our human-human contact was crucial in allowing our healthcare system to build up the capacity it needed over the last 6 weeks. But there's another reality, which is that we anticipate this virus being with us for quite a while. The best case scenarios that I've heard, which would really be unprecedented in speed, is that we could expect a vaccine for this virus in a year or a year and a half. Well, we cannot afford as individuals or as a community to practice this level of extreme social isolation for a year and a half, waiting for that vaccine to come around and be readily accessible for everybody in our community. And so we have to find somewhere in between those two extremes. And when you hear people talk about going through phases, the idea behind that is that we want to go about this gradually, exploring what we can do as a community to re-engage our lives to the greatest extent possible with what we've known before, but doing it differently than we did before to minimize our individual ability to spread this virus and to contract it. And so you start out with phase one, which is what will start in Tulsa on May 1st. And that is where it's an initial attempt to identify things that we can do that minimize that risk. And so our current shelter-in-place order will expire at the end of the day on April 30th, and at midnight on May 1st, a new order will go into place that enforces both federal and state guidelines here in Tulsa. And this is our community's part in trying to identify what life is going to look like for the foreseeable future until treatment for COVID-19 is readily available for all of us to access. And so before I get into what that looks like, I want to set the table, if you will, for the recognition that just as ramping up these social distancing practices was not a uniform and orderly process, doing something that our community had never done before. Some people did it better than others. Some didn't do it at all, but it wasn't like a perfectly choreographed and executed social distancing implementation, nor should we expect that as we go about trying to identify those practices that protect us as individuals and allow us to go about our lives with reduced risk moving forward, will that look perfect? We will all try the best we can, but we need to have, again, some grace for our neighbors as we go through this and go about it, as we always do as Tulsans, focusing on just the next step ahead. So on May 1st, we will begin enforcing the state guidelines for businesses that have been issued by the governor. I want to be clear that those are not helpful tips in Tulsa. Those are guidelines that will be enforced in our community, and they will be enforced by the Tulsa Police Department and the Tulsa Health Department working together. I would encourage everyone, after this briefing is over, you can go to our COVID-19 landing page at cityoftulsa.org and see the general overall guidelines for businesses, but also links to the state's specific industry by industry guidelines. And I think what you're going to see when you look at those is that different industries have different practices that their larger industries have identified as best practices that can be deployed here in our community that will reduce your risk of contracting and spreading COVID-19. And I can give you good examples just from our operations at the city government in Tulsa. We've been going through this for about 2 months now. And while we have some employees who are able to remote work and have been doing that, we're really a very outward facing organization. Police officers, firefighters, crews that work on our water and sewer systems, they don't get to work from home. They have to be out in the field. But thanks to outstanding departmental leadership and close collaboration with the Tulsa Health Department, each of those departments over the last 2 months have instilled practices that minimize the ability of those people on our teams in those different departments to be exposed to and spread COVID-19. And because of that, we have about 4,000 employees. And so far, we've had 3 employees test positive for COVID-19. So while clearly staying at home is the best thing that you can do to avoid contracting and spreading this virus, the reality is there are practices that any organization can put in place that greatly reduce the ability of its employees to also contract and spread that virus. And the guidelines that are being put out by the state and the federal governments and by the Tulsa Health Department are really intended to put those practices in place that minimize that risk. And so we will begin enforcing those on May 1st. We will have a prohibition on social, seasonal allergies there, not anything else. We will have a prohibition on social gatherings of 10 or more people. I want to be clear, we ran into this when we had that same limitation as we were ramping up, that work is not a social gathering. Business operations as approved by the state are not social gatherings, but other social gatherings, as hopefully most of us can recognize by this point what that entails, are limited to 10 people or less. Let's see here. Special event permits will not be issued before May 15th at the earliest in Tulsa. We will continue to restrict gatherings to 10 people or less. We will also have, as I mentioned last week, our city parks facilities, and there was some confusion around this, and I apologize for not being clear. City parks pools, so pools that are owned and operated by our city park system, not every person in town's pool, just the city parks pools are closed for the summer, as are day camps at our city parks system. Moving forward, those sports that lend themselves to social distancing, those facilities will be open with proper social distancing and hygiene practices in place on May 1st. Those sports that don't lend themselves to social distancing will continue to be shuttered at our city parks facilities moving through this phase 1 period of time. I want to reiterate that all of these guidelines will be available on the City of Tulsa website, cityoftulsa.org. You'll see a little bar at the top. It says COVID-19. You can click on that, and it brings down all the different guidelines by industry. And those will be enforced by the Tulsa Police Department. And I'm sure the question will be, well, what does enforcement look like? That ranges everything from citation, if someone just insists on not complying with the guidelines that the state has set, to if there is a business that is flagrantly violating those guidelines and causes an outbreak, we reserve the ability, working with the health department, to declare that business a health nuisance and shut it down entirely. So I would encourage businesses to take the guidelines that are being issued by the state of Oklahoma very seriously, because they are being enforced, will be enforced starting on May 1st locally. I really want to thank everyone who's worked in an outward facing organization who hasn't had the ability to social distance throughout this, for the risk that you've taken on. And I especially want to thank everyone on our team at the City of Tulsa, who I think has set a great example of what different organizations can do when they implement these practices and take it safe. As always, the very simple rule of thumb here is the less people you come in contact with, the less your odds are of contracting this virus or spreading it. And so I'd ask all Tulsans, please keep that in mind as we move through phase one and try and identify what the future looks like for us as a community and what we can do that allows us to go about our daily lives in a freer way than we've been able to over the last 6 weeks, but also doing so in a way that protects our neighbors and ourselves. Thank you.
Thank you, Mayor Bynum. Tulsa County Commissioner Karen Keith, don't forget to unmute your microphone, please.
There we go. Okay, very good. So, Mayor, thank you. That was information I think we all needed, so I really appreciate that. On Monday of next week, the resolution restricting access to the Tulsa County Courthouse is set to expire at midnight. However, the courts will remain closed through May 15th at the direction of the Oklahoma Supreme Court. If you're doing business at the courthouse, please wear a mask. Some county offices will not allow you to enter without a mask. You're still encouraged to do your business over the phone, electronically, or by mail. Again, follow the CDC guidelines to keep both you and the county employees safe from the coronavirus. Please wear a mask and don't be surprised when you're interviewed by the sheriff's deputies before being allowed in the building. Now, kudos to the Tulsa County Building Operations Department as they finished building the first batch of 13 UVC boxes that can be used to sterilize masks. These boxes were sent to various county departments, and we're so lucky to have these talented folks working at Tulsa County. Now, in regard to this Friday's phased reopening for county parks, La Fortune Golf Course and Grill, South Lakes Golf Course and Grill, and the Case Tennis Center at La Fortune will reopen with restrictions. Staff have identified numerous new ways to encourage social distancing while maintaining enhanced cleaning. You can go to the Tulsa County website for each entity to get all the details so you can both make a reservation and know what will be expected of you. Now, outside events and tournaments are still postponed, as are youth activities and all driving range vendor functions. Now, we have yet to determine if our pools and splash parks will open for the summer and are looking at regional, state, and national information and data that will help us identify if we can open them safely. Several metro parks departments are also going through these similar exercises. Now, we will not open playgrounds at this time, but we'll continue to evaluate on an ongoing basis as we move through phased openings. When we do open our playgrounds, we want to ensure that we can maintain the cleanliness of the area and keep practicing social distancing. The OSU Tulsa Extension Office and the Oklahoma County Home and Community Education members have volunteered their time and money to create 1,000 handmade fabric masks that they donated to local hospitals, medical facilities, local community members, and local grocery stores and businesses. So just a shout out of great work to them. And the Tulsa Area United Way has joined forces with Family and Children's Services Child Abuse Network, Inc., and the Parent Child Center of Tulsa to provide education about ways to identify and report child abuse during this period of social distancing and virtual schooling. Unfortunately, this is a real issue, and we need to continue to be vigilant for those that may not be able to help themselves. To report a child at risk, you can call the Oklahoma Child Abuse Network hotline at 1-800-522-3511. Calling the hotline allows the appropriate authorities to open an investigation, gather facts, and protect the child if they're being harmed in any way. You can also visit the childabusenetwork.org to find out more information and to get help. If you yourself need help managing stress, please call the COPES helpline at 918-744-4800. Additionally, Domestic Violence Intervention Services, along with the Family Safety Center, the District Attorney's Office, local law enforcement agencies, and other organizations are continuing to work together to ensure that victims of domestic violence are made aware of available resources to them. And you can visit divas.org for more information. So I want to leave you on a happy note today. A new Route 66 icon, Buck Adams on 11th near Peoria, will be lighting up tonight as part of an effort to bring more neon signs to the Mother Road in Tulsa. So if you're restless, go drive by after or tune in at 7:25 on Buck Adams' Facebook page to watch the lights come on. Up next, Police Chief Wendell Franklin.
Thank you, Commissioner. Chief of Police Wendell Franklin.
Thank you. Thank you, Dr. Dart, Mayor Bynum, and Commissioner Keith for your bold leadership. And also, I want to thank the area leaders as well, area officials, for their leadership as we have dealt with this pandemic. Our enforcement efforts for the city of Tulsa continue. The updated civil order, we will continue enforcing that piece. I encourage business owners, business leaders to go to the City of Tulsa website, go to the State of Oklahoma website to determine where your business falls in that plan to reopen. It is imperative that we follow those guidelines, and the Tulsa Police Department will not issue any warnings for those violations, or they will be citable or arrestable. Our call response to collisions and other services will return to normal. We have to do this because we anticipate an influx of people on our roadways and being away from their homes. The traffic and motor units, they're going to resume normal enforcement efforts. Drivers who have gotten into the habit of speeding or running red or yellow lights during this time period of lighter traffic, they will see our motors and our unmarked police cars out on the roadway. Those type of activities are what causes collisions, and we certainly don't want that to occur. We will not issue any warnings for those traffic violations as well. The threat is not over. The threat of exposure to our officers, and it's not over. So we'll continue to utilize PPE. You'll see officers wearing masks at points, and we will continue to practice social distancing to the best of our ability. The Tulsa Police Department employees will continue to work remotely. We have decon capabilities at all of our police facilities and are routinely decontaminating our building and our patrol vehicles. The public windows to the uniformed divisions remain open, as they always have during this pandemic, during regular business hours. Our Tulsa Police Records Division remains closed at the moment, but we are exploring how to better serve our customers in person. So look for information for that in the very near future. To date, the Tulsa Police Department has experienced one positive COVID-19 case, and that officer has recovered. We understand that we have inherent dangers that come with our jobs in law enforcement, but we continue to meet the needs of the community. And I'm proud of each and every officer that has stood on the front line in the face of this invisible enemy and continue to provide professional service. If you see an officer, please thank them for their service, as well as our medical professionals and others out there on the front line, ensuring that service continues for this city. I also want to thank our community, the businesses and individuals who have stopped their normal work, and they've shifted their focus to provide goods and services to our community to keep it safe. We've had a number of businesses and individuals who have stepped up and volunteered and given needed supplies to our police department, needed supplies to our city. This has made things so much easier because we continue to have procurement issues with some of the PPE and some of the sanitizing equipment. So thank you for that. It makes our job a lot easier. I want to end by thanking Tulsa and letting each of you know that Tulsa is truly one Tulsa. We're one community. Thank you.
Thank you, Chief. Please stand by as we bring our other panelists back for questions.
Our first question is from Fox 23 for Dr. Dart. Is Tulsa County still preparing for a hospital surge in mid-May? What are they doing to prepare for that if they are?
You know, we're following the data, and we're actually listening to what the data tells us. Part of pandemic planning is to ensure that hospital capacity is not overwhelmed in any time frame of a pandemic, and so we are doing that here as well. And with the opening up now of elective surgeries, hospitals are telling us that they can handle that in addition to the potential surge in COVID patients. And it's just one of those situations where we'll have to see what plays out in the environment. Hopefully the community will continue to socially distance and stay apart so that the potential for surge is hopefully will not even be an option.
Okay, for Mayor Bynum from Channel 6. Other large cities in Oklahoma are saying that they meet all 4 gates set by the White House to reopen, including Oklahoma City. Last week, you said Tulsa had not met those guidelines since cases were trending up. Is that still the case? And if so, do you think there's a reason for that?
Well, that is accurate based on all the data that I get from the Tulsa Health Department, including about an hour before our presentation last week, as to what it's looking like, what those trends look like now, and why that phenomenon, why Tulsa might be different than other cities. I would really defer to Dr. Dart as the public health expert here. But the reality is, you're right, Oklahoma City have met the criteria. In Tulsa, I do want to be clear, we meet the criteria on the hospital capacity side. Based on everything I'm hearing from our hospitals, we've met that gating criteria. But it's on the overall trends relative to cases and symptoms where we haven't been meeting that. We have not met that criteria. I even checked again with Dr. Dart last night and told him to please let me know as soon as we do hit that criteria, but we still have not. And I would defer to Dr. Dart for the rest of the question.
And Mary, you're absolutely right. And so now we've actually changed from a 4-day rolling average to 7-day because that's what the state is doing. We're not seeing that that decline in cases. Also, our syndromic surveillance is showing that we're not seeing a decline in symptoms as well. So at this juncture, from a clinical perspective, we're not meeting that gate.
Okay, Dr. Dart from Channel 8. We seem to be seeing a daily decrease in numbers of cases. How does that square with where Tulsa stands in being ready for reopening?
Well, in Tulsa, we're not seeing a steady decline in cases. I mean, best case scenario, we're in somewhat of a plateau, but there's no decline whatsoever. And until we get that decline, we're really stuck in this phase. And it's important that we continue to expand testing. It's important that we continue to do contact tracing so we can keep people safe. But as we follow the data, hopefully as we continue to test in our community and try and figure out really the total penetration of the virus in our community, we'll have a better idea of what those test numbers truly mean. And bottom line, though, is that we want to see that trend go down. Best case scenario, it's kind of in a flat state line, but it's not where we want it to be. And until it gets there, this conversation really won't change.
Okay, Dr. Dart from Channel 6. Governor Stitt said yesterday, anybody who wants a test can get a test, even if they don't have symptoms. Is that possible here in Tulsa?
So I think all the healthcare systems, our focus and our priority has always been on those who were most at risk and need that test. Has always been on if you were sick with COVID symptoms, if we knew that you had definite exposure to a COVID case. So that's what we've been focused on in testing. Bottom line, though, is that we will, if anyone calls us and they absolutely want to test, we will test them, but we're going to maintain our priority on those who are most at risk.
Okay, Fox 23 for Mayor Bynum. Will the municipal court reopen soon so businesses and people who have been cited for violating your previous orders can be prosecuted? And so people who are cited in the future for breaking new rules can be prosecuted?
I'm having discussions this morning with our municipal courts team on the proper reopening. Oklahoma State Supreme Court, I believe, had set a plan to reopen courts around May 15th or 16th, and we were planning to follow that, but with the county making their announcement today, I think that gives us certainly a pause and a desire to look at what we can safely do. And so I'm talking this morning with our courts administrative team as well as our facilities team about what we might be able to do on that front to reopen our courts in a way that provides safety for people who need to be processed through there.
Okay.
So I don't have a yes or no answer today for you, but that is something that we're looking at, and we should have a decision made in the next couple of days.
Okay. Mayor Bynum from Channel 8. You talk about enforcing regulations and guidelines on social distancing. How do you plan on doing that?
Well, it's very simple. The guidelines that are put out by the state for businesses and industry are very clear on what should be done to prevent the spread of this virus. And I'm glad that question is asked, because one thing that I didn't mention earlier, and that I think we can never say enough, is that the virus has not suddenly decreased in our community. As you heard Dr. Dart say, our positive test cases are not decreasing here. So the virus hasn't decreased at all from what it was yesterday or a week ago or 2 weeks ago. In fact, our positive cases were ramping up as of Friday. So I think it's important that everyone recognize that as we're going into this, we're not celebrating that the virus went away. What we're trying to do is identify ways that we can go about our lives closer to what we used to know with reduced risk. Recognizing also that we just cannot maintain shelter in place for the indefinite future. And so when we talk about enforcing guidelines, I can guarantee you this is not something that Tulsa police officers or anybody that works at the health department is super ecstatic about having to do. But we're going to do it because it's necessary to minimize risk for our community and protect the safety of Tulsans. So if individuals see a violation of guidelines in place, they should absolutely, as people have throughout this, report those to the Tulsa Police Department non-emergency line, 596-9222. And we will work with the Tulsa Health Department to respond to those. I do want to, be clear that most of what we've had to do to date has not been on citing and arresting people. It's been around educating people on the practices that ought to be in place. And I could expect that a lot of that will have to occur as we try and navigate very new terrain for all of us in our community moving forward. The other way that we're going to track this, though, is thanks to the Tulsa Health Department's very strong contact tracing program. Now, I don't think that's something that they get enough credit for. You hear a lot of people in the last couple of weeks talk about how important contact tracing is. Tulsa Health Department's been doing that since the very first case in the state of Oklahoma was identified here in our community. It's one of the reasons, by the way, that we as a city government have been able to operate in the way that I described earlier. It's because anytime that we have a city employee who's potentially been exposed, they find out very quick, thanks to the contact tracing program at the Tulsa Health Department. And we're able to isolate that individual and prevent any potential spread until we know that they're in the clear. Well, the other thing we can do through that moving forward is if we identify a business that is the cause of an outbreak and they are clearly not following these guidelines, then we will not hesitate to declare them a health nuisance and shut them down. And we've had to do that already with a couple entities here in our community that were not following the orders in place. And we won't hesitate to do it moving forward if there are businesses that are not valuing the safety of Tulsans.
Okay. KRMG for Dr. Dart. OSU has requested an emergency use authorization for a COVID-19 saliva test from the FDA. Is that a game changer in terms of finally getting a significant part of our population tested?
We really don't know yet. Right now, we're going to start using that test to test long-term care facilities here in Tulsa. We're going to focus on those because we can do large numbers and do it rapidly. But I think it's too early to say it's a game changer. I think that was the initial hope of bringing this test out. We just started using it, so we'll know more as time progresses, and we're going to hope on the side of positive. But right now, we actually don't know.
Okay, Dr. Dart from Fox 23. We received a unique question from a viewer, and I was wondering if you could answer. As people return to work, there are people who like to take smoke breaks, sometimes in groups. Can someone who is exhaling cigarette smoke or vaping still spread the virus, respiratory droplets that we've been trying to protect ourselves from?
Anytime somebody exhales, they have the potential for spreading respiratory droplets, and in the scenario of someone who's smoking, that exists as well. So absolutely. From public health perspective, we've always been saying stop smoking for multiple reasons that are health related. Here's another reason why people should really consider stopping smoking. But that activity, whether it's smoking or vaping, will result in droplet spread from individuals. And so it's a conduct that we would recommend you not do.
Okay. Fox 23 for Mayor Bynum. Tulsa did not allow personal and pet care places and spas to reopen on Friday by appointment, only like other cities, because the shelter-in-place order was still in effect. Are these businesses allowed to reopen in phase 1 on Friday?
Yes.
Okay. Dr. Dart from Channel 8. We talked about the peak being around late April, but it seems it came much earlier, as in the weekend of April 3rd. Is that the case? Are we now on the other side of the peak?
Not yet. And frankly, we won't be on the other side of the peak until we see a distinct trend in declining cases. Because to just see the trend somewhat plateau, we're still getting multiple positives on a daily basis. Our daily positive test rate is still higher than we would like to see. So until we see that trend and numbers go down consistently from day to day, we won't be there until we're at that juncture.
Okay, our last question is for Commissioner Keith from Fox 23. In a news release sent out today, there was a list of questions people will be asked when entering the courthouse. If someone were to give an answer that a deputy believes shows a potential health concern, will that person be barred from entering the building that day? And when will they be able to come back?
They will be barred from entering the courthouse that day, and they won't be able to come back until they can answer yes to all those questions.
Okay, thank you guys. This concludes our press conference for the day.
Thank you.
Thank you.